All right, welcome to another episode of the John McEntyre Show live prime time. I'm John McEntyre, and I know you know who I have with me on the set, Andrea McEntyre, financial expert, all of that other good stuff, wife, mother, um, any other titles?
We'll
Yeah,
sh- we'll, sh- we'll spare everyone the
and
pain.
his and it's Friday evening, so we're ready for it. As you can tell, we're in weekend mode here, but we have a good show tonight. The night today we're talking about, this is Medicare Friday, and so we will be discussing the difference between. Well, let me set it up like this. We have Medicare AEP coming up for
Yes.
the Medicare Advantage people that will be the changing plans or something like that.
Annual enrollment
Annual
periods.
enrollment period. That's what AEP means, and so today we're going to discuss the types, because people, we get the question a lot, what's the difference in networks between HMO, PPO? And so that's what we're going to talk about today. We're just going to talk about some of the advantages and disadvantages of each.
Sounds like a
So,
plan.
all right. So what we'll do, we'll get into share the wallet win. This is Medicare Friday, so we'll share a Medicare wallet win. And so you had a very good story for us. So share that with everyone.
Well, as John has told a lot of people, we offer a free consultation,
Mm-hmm.
and it will allow us to just kind of review what you have going on. But it always starts like you do with a doctor,
Mm-hmm.
with a financial checkup. So we want to just review where you are, and we often also talk about your goals and your whys. But
Mm-hmm.
once we dig into it, one of the areas that I have a lot of fun with is, once I understand what some of your goals are,
Mm-hmm.
is to understand where's the money.
Okay.
So when we're looking at what is your financial picture, what are you spending money on, where what money is being brought in, and what things you may currently have, that's used for us to have a current snapshot of where you are and helping us get organized to see, are we close to the goals or how much work we have to do.
Mm-hmm.
And there
Right.
could be, during those discussions, some pain points. And within those pain points, there could be some urgent and immediate things that need to be evaluated.
Mm-hmm.
And I was working with someone who is, they currently have a Medicare Advantage plan,
Right.
and they were trying to decide what they should do. Should I stay with it, or can I afford having a Medigap plan or a supplement plan, based on some of their specific needs?
Okay.
And so when they were asking, can I afford it? I said, well, let's look at where you are. And we were able to look through their finances. And I was able to help them see, you have a whole lot more discretionary income than what you thought. So when we looked at everything, turns out they can comfortably, and that's what gave them peace of mind. They could comfortably afford a Medigap, or what's often called a supplemental plan, instead of having to take a Medicare Advantage plan that's zero premium. And I want to say this, John, just because you take a Medicare Advantage zero premium plan, it doesn't mean that it's a bad plan. But some people will make those choices only because they feel like they don't have another choice or they can't afford it.
Right. Exactly. It's not to be, you're not to be shamed.
No.
It's some people out there that think because they're on a supplement plan that makes them better. Um, Overall scheme of things, the supplemental plan G, it is like what they would call the Cadillac or the Lexus of the Medicare insurance plans,
Mm-hmm.
because it covers so much. Once it does have a premium. Once you pay the premium, um, that's pretty much all you're going to do. It's going to cover everything else.
Yes,
You know
you're
what?
out of pocket.
Yeah, everything out of pocket. What Medicare doesn't cover, it kicks in. It's in addition to Medicare. So you have Medicare, you have supplemental plan, Plan G. Most time you hear Plan G N, something like that, and then you have your prescription drug plan. Whereas on Medicare Advantage side, the company replaces the Medicare,
The original
the
Medicare, the
original
A and B.
Medicare, it replacement. And that's what sometimes it's called that in the industry, a Medicare replacement. It does everything that Medicare does. It has to, or Medicare will not approve it. And then it usually has the drug plan and some of the extra perks, gym memberships. That's where you hear silver sneakers, it may have some vision, dental, things like that, some extra perks, and they're usually zero cost plans and everything. But like I said, overlook, the overall scheme of things. If everyone had their choice once they saw it, they would probably just choose the supplemental G or the N, but normally it's the G that people would take. And then even then it all depends. And so it's not to be what everything was created for the market in mind. There's some things that there's a segment of the population that wouldn't be able to get a supplement anyway. They wouldn't be able to get, so they were using an Advantage plan. So there's no shame in using an Advantage plan or whatever. It's just that if there's certain criterias that don't pertain to you and you can't afford it, then a supplement plan is the best way to go. But if there's certain things that's going on in your finances, then there's nothing wrong with an Advantage plan, because it is better than just having original Medicare and a drug plan.
Absolutely, absolutely. So I'm glad you mentioned that, because one of the things that I really would like for us to dive into is, no matter what plan you have, you want to make sure you understand what you have and what it covers, because everyone's health and financial situation is very different. So
Right.
you want to make sure that you're looking to see, does it fit my needs? Because what your neighbor may have, or your sister or cousin may have, it may fit them, but it may not be the best option for you.
Exactly. And so tonight, when people are talking about the Medicare Advantage plans, like I said earlier, they think, they hear PPO and HMO, and we're here to distinguish the two and share some advantages and disadvantages. So let's get into this. Well, because they do differ in certain ways, and like I say, each one has its advantage and its disadvantage. So what's one of the ways that they differ?
Well, one of the number one ways that everyone should remember that they're different is based on their size. So
they're both networks, so size of network.
Yes. And when we say the size of the network, with what network we're talking about, so with an HMO and a PPO, it means the network of doctors, hospitals,
your providers, all of your healthcare providers, right?
And depending on the size, that could limit what's available, especially depending on where you may live.
Right, exactly. HMOs are usually smaller, because with the HMO, we all know that everything goes through the primary care physician. And that's where you hear the word referrals. You hear the word referrals with an HMO. When you hear referral a lot, you can automatically, assume that it's a HMO plan in the works. That means if you had to go to a specialist, the primary care physician would have to make the referral.
Yes.
They would have to deem it, that it's medically necessary, things like this. Then as you move through and things become a little bit more technical or deeper, health wise or whatever, then, the plan would decide, okay, will we cover it?
I'm glad you brought that up, because the within that size, because this is private insurance, the doctor who's your primary care, who has the most interaction with you generally, because you have that required annual visit. So they're looking at everything, and so they are more like the quarterback,
right?
And they're deciding, who do we bring in for specialists if there's something else that's going on. So if you need to have a specialist, they are usually they would be the most qualified and knowledgeable to make that recommendation. So they may make that recommendation, and then the referral goes through, and then depending on what type of service is needed, then that's when the insurance provider
Mm-hmm. Mm-hmm.
would make that decision. And in most situations, if these are standard type of care, um, getting a referral is usually not an issue. When it's more complicated type of things, they may want you to look at a few options
Right.
before, let's say, going to surgery or a specific type of drug or something.
Right. And it's also, you may decide to, to get a second opinion or something like that.
Or a third,
Yeah,
but
or a third opinion. It doesn't hurt to do that. And with a PPO, their network is larger, mainly because with a PPO you can go outside of network. You can pretty much go to any doctor or specialist that accepts Medicare Advantage. If they accept the plan, you can go to it. With an HMO, that's not the case. If you do go outside of network, then it could be more expensive.
absolutely.
Um, with the PPO, also sometimes they have a network, and you can choose to go outside of network. And even in those cases, if you do go outside of the network of the PPO, it may be a little bit more expensive. Your copay may be, for instance, inside of a network, it may be 45. You decide to go outside of the network, it could be 55 or something like that. It all, it pretty much all depends, on, and you get to make that decision.
Mm-hmm.
So that's one for instance, perfect example. I shared a story about my father the other day, and he's on a Medicare. He's on an Advantage plan, a PPO, um, and he's also one of the perfect example. I wasn't with him when he chose his Medicare, when he went into Medicare. I wasn't involved in that situation. When I came into the picture and I was looking at his finances, I asked him, I said, why didn't you go with the supplemental G plan? Well, no one told me about it. And someone else in the other side of the family was a nurse, and they made that choice
Mm-hmm.
instead of doing it the way that it should have been done, which was, and I told him, I said, I'm looking at your finances here. You could have afford a supplemental plan. Well, can I get it? I said, well, not now, because that's also one of the things. We'll just talk about it right here. In the beginning, when you first go into Medicare, they have what they call they don't there's no qualifications. Just being on Medicare, coming into Medicare, you can go into any plan you want to,
Yes.
whatever you want to do on the supplement side. You can choose supplement or advantage. But once you make your choice, if you choose advantage first, then you have to go through a
Underwriting.
health underwriting to actually, I appreciate that it is Friday, because underwriting just was not in my database. Underwriting, you have to actually go through underwriting to switch from advantage over to a supplement plan.
And if your health has changed,
Yep.
or
Yep.
you knew when you first went on Medicare, if you had some health concerns, you got that free pass when you made your first selection. But let's say a few years later, your health has either stayed the same, or it could have gotten progressively worse, or
Mm-hmm.
in some cases better. Some people may
Yeah.
be diabetic, and then they have lifestyle change and come off of it or something like that. But there are, in many cases, when someone starts on Medicare and then when they look 6 months, 12 months, 24 months later,
Mm-hmm.
a lot has changed, their
Right.
vision or other
Yeah,
things.
some things may change, but that is to say, if you chose an advantage plan first, then you have to go through underwriting, and it is a serious questionnaire. Um, I mean, it's a very small percentage of people that actually get accepted over to a supplemental plan, because now they can choose whether or not to cover you. Where in the first beginning, there was nothing. You just went in, whatever, no underwriting. Now you
Mhm.
have now they can actually do it. Um, and in my father's case, he was like, okay, well, I'll look at a supplement plan. I was like, you will not be accepted, because some of the issues that you have, um, you won't make it through underwriting.
They're
Yeah.
not they're whether it is small or it's major, they all make the difference, and they're able to look at everything.
Yes, yes, and they will do it because they're going to. If you can't afford it, and they cover so much, and you don't pay anything, other than maybe your maximum out of pocket with your prescription drugs, things like that. You paid a small deductible, about 240, 250,
Hmm.
and then you're just done. The supplemental plan just takes care of
All you're paying is your
everything.
monthly
You're
premium.
just making your monthly premium,
Hmm.
and also your Part B premium. You're
Yes.
paying that. But then after that, yes, on the Medicare Advantage side, they do have a maximum out of pocket, but they can get up to $5,000 to $7,000,
Yes.
which is not exactly bad because, say for instance, you're diagnosed with cancer or something like that, and it's covering. Once you do hit that maximum out of pocket, then the plan kicks in and takes care of everything. But had you been over here with the Medicare supplement, just right out of the gate after 240, it would have just started taking care of everything. So
Hmm.
that's some of the advantages and disadvantages. But the size of the network, just to bring it back home. And before we move forward, I actually want to show that Sue Roberts said hello to both of us.
Hi,
So I
Sue.
want to give a shout out to Sue, as what she's one of our faithful viewers here, and so we want to make sure and recognize Sue, that she's watching. Thank you for watching with us, Sue, this evening. But yeah, so size of the network is one of them.
Hmm.
What's number two? What's another?
Another one that's a hot button for
And we
everybody
did
is
mention it.
it's
Mm-hmm.
referrals.
Mm-hmm.
We mentioned it earlier, but referrals is a big thing. And what that means within an HMO, for example, your primary care physician will need to refer any specialist or anyone that you see outside of their office. And um, sometimes it's a headache. They want you to go see someone, they do the referral,
They
and
schedule it. They do do all
and
of
you
that good
think
stuff.
you think everything is handled, and then you go to show up for the appointment, or you get an update saying we had to cancel that appointment because we didn't get the proper paperwork.
Right. That's right.
Now on a PPO side, the PPO, you they don't require referrals. So if you need to go to a specialist or something like that, your primary care physician can recommend someone,
Mm-hmm.
because you may not know which chiropractor, or maybe it's a eye surgeon or something like that to go to. So they can give you some names, but you don't have to have your doctor to make that referral for you to go. Now, I will say this with HMO and PPO both, if your primary care physician is recommending that you see a specialist, the insurance company, the provider,
Mm-hmm.
they will review that information. And there's some situations that they may come back and they say, well, have you considered these other options before going the surgery first?
Right. They will do that most of the time, HMO, and they may deny it. And so you brought up an excellent point. And so I'll address it while we're right here. Is just because they've denied it once, don't mean that you cannot contest it.
Absolutely.
Because a lot of times, and I mean the actual percentage of like contesting it and actually having it accepted is pretty high. I mean, I'm like up to upwards of around 80%. I've seen, it gets kind of high to where people then get denied, then they just go away. Where if they come back and contest it, talk with their doctor, I was about to say daughter, but talk to their doctor, um, it can be reversed, and they can actually accept it.
Uh, that's absolutely correct. And another thing that is good news for everybody, we talked about this maybe a month and a half, 2 months ago, some of the
Mm-hmm.
changes that are upcoming for the 2025 uh, year, the plan year,
Mm-hmm.
is that they're requiring the insurance companies to provide an feedback on any type of referrals or any requests in a more timely manner, because a lot of people have complained and has stated, well, I'm always denied.
Right.
Or
Mm-hmm.
and the physicians, they're very frustrated that they're making these recommendations for their patients who they know and they've spent time with, and the insurance providers are, they're rejecting or denying those referral requests. So
Mm-hmm.
you want to make sure that you're paying attention to contested. You don't have to say, it doesn't mean that it's a 100% that the second time they'll approve it.
Mm-hmm.
What we're saying is, if you get denied, it doesn't mean quit. It means go back, work with your doctor, see what you can do, because it could be approved the second time around. And they're improving the timelines. They're requiring them to be more timely.
Right. So there you go. So sometimes going out of network, we're bringing it back because we were talking about the actual referral networks, things like that. Um, with the referral, the second part, well, we have to mention the PPO. Um, with the HMO, you would actually, doctor pretty much does the work. They set
Mm-hmm.
up they make the referral, they do this, that, and the other. They already know who they can talk to, specialist wise, this, that, and the other.
Mm-hmm.
PPO, the PPO Advantage plan is different to where you can make the call.
Yes.
Like, say, for instance, with my father last week, it was some things that he needed to see a specialist for, MRI type work, and the network hospital that he's part of, was booked solid. Well, with him having a PPO, I was like, okay, well, I talked with the specialist who wanted the test done, and I said, he was like, okay, well, um, he's on this particular plan, correct? I said, correct. He said, well, I know the other hospital network, they accept it. He said, we do that a lot, so call them, and he said, you'll probably get it done sooner than later. Call them, and they was like, okay, it was like 2 days later, I was taking him over there.
Oh, wow.
Whereas inside of his primary hospital network, it was um, it was six months out.
Wow.
Called the one outside, and it didn't cost any more because they accept the plan anyway.
Mm-hmm.
So there was no he really wasn't going out of network. It was just that he had chosen this hospital system, um, for his primary care and things like this. But the other hospital, which was same distance, as his primary, just a little bit further than his primary care physician, they accepted it. And I made the call, and they were like, "Okay, we have something open." And it was like 2 days later, and I was like, "Oh yes, let's jump on this." Took him over there, and it was taken care of. They already knew what he was on, which plan he was on and everything, and there was no big deal. So sometimes going out, if you own a PPO and you can choose in or out of network, it may be expensive or it may not. So that's why you check your plan and say, okay, well, in my area, all of the hospital systems accept it. So I really won't be going out of network anyway. So my primary care physician may be over here, and then I can do, go into a different direction. With um, so we talked about the referral part. We talked about the network, and make sure before we move on with the actual going outside of network, really pay attention to that, because that can stack up quickly. That can eat up a lot of your out of pocket costs. Um, Sometimes venturing outside of your network can add up to $7,000-$10,000 real quick.
A
So just
good
stay on top
example
of that.
would be urgent cares and hospitals. If
Mm-hmm.
you're going outside of your main network for those, they
Well,
can.
with urgent cares, emergencies and urgent cares, those sort of fall into a different category, as far as Medicare is concerned, because those are like emergency things.
Yes,
So you don't have to stay in network for emergency, and urgent care is considered emergency.
you're
It's,
absolutely
it's
correct.
considered it's considered emergency. So if you need to go to an urgent care, it doesn't matter. You could be halfway across the country. If you need to go to the hospital emergency, if it's an emergency, you go. Everyone will accept it. It doesn't
Yes,
matter. In network, out of network does not count because it's Medicare.
exactly. But if you're visiting your kids and you're in a different state and they're outside of your network, those situations could be very different. So
Yeah.
just always check your benefits.
So always check your benefits. Yeah. So it was good that you mentioned that, because that was, the next thing we was talking about, in and out of network, and then visiting emergency rooms and urgent cares. So that answered that. Last one is basically, um, just deciding which would be best for you, because I know some people that they don't travel a lot. They don't, they like where they live, like especially when you meet the people in the small towns or people in larger cities who like the shrank their circle,
Yes.
where they
Yes.
venture, because a lot of times that's what, especially in cities, a lot of the retirees, they'll start moving closer to hospitals, like that
Mm-hmm.
becomes very important, where it used to be, I want to live close to work. Now I kind of want to live close to my medical care, things like that. Hospital, it becomes very important,
You want to
which it should.
reduce your commute
Your
time,
your commute time,
and
right?
you want to be able to get the care you need as quickly as possible, because there's nothing worse than something happened and you have a long way to travel.
That's right. So in those cases, we may be sitting down with someone who says, you're looking and says, okay, well, the PPO is very good for you, and the HMO is just as good here. Okay, which one accepts all of my doctors? Well, the HMO accepts all of your doctors. Okay, I will stick with them. Some people, they just want to stay with their doctors, so they will go with the HMO, because the PPO may not accept it, or the PPO may charge more, because sometimes you see tiers with PPOs. You see it sometimes with HMOs, but most of the time with PPOs, you'll start seeing tiers of the doctors. They may be in the same office, but this doctor may charge a little bit more to see, you, where this doctor wouldn't. Um, Whereas, with HMO, sometimes they say, hey, they accept everyone. I'm fine with the HMO. It's a zero plan, accept everything. We've looked at my medications. That's going to be taken care of, this particular plan. So I will go with the HMO. Another person may say, well, I may venture out a little bit further. So I may venture 30 or 40 miles every so often. So if I'm going to stay with the kids and I have an appointment, I know I could go over there to this one. So a PPO would fit me better.
Absolutely.
Those are the type of examples. So that's why you would want to sit down with someone who can really help you choose your plan, and not just make the decision based off of
The monthly premium.
Yeah, the monthly premium.
I, I wanted to bring something up that I worked on this week with someone, and they were in the same situation where it came to tiers. So their doctor was accepted within the HMO and the PPO, but he had two different offices that he was working at.
Right.
So sometimes it could be as easy as looking to see what all offices your doctor may actually have. And then based on how far apart the offices are, because most of the time they're not a great distance.
No.
Um, and so they were able to, they made the decision, it worked out going the PPO route, but the office that was closest to their house was actually on a different tier. They went 2 miles farther away, and they actually were able to keep the cost down,
Right.
just by going to his different office.
There you go. So there you go. But before we go into our question of the day, we covered everything. I actually saw a question come across here. Let's see who we have here. So we have Sue Roberts. She asked, what do you think about the Aetna insurance? It's spelled Aetna, but it's Aetna, the Aetna insurance company. So Aetna is one of the big boys.
Oh yes.
Yeah, they're one of the big players in Medicare, well, healthcare. Period.
I was going to say healthcare,
I mean,
because
we have it. Yeah, we have Aetna healthcare. And we're in the under 65. So they're one of the big main players out there. You have the Aetna, the Humana. When my first exposure to Medicare with the company, I specialized in Aetna. That's all I worked with was Aetna, and the people, they were happy, no complaints. You have the people that's with Humana, you hear no complaints. People with Aetna, no complaints. the people with well care, no complaints.
Yes.
You know,
So
so with Aetna, uh, under 65, I'm very favorable. When I turn 60, when it's time for me to go into Medicare, well, I probably never will get there. I probably never get that old.
you're not Benjamin Button.
We'll see. But when I get there, and if I have to choose one, me personally, I probably would go with Aetna. I mean, that's just me.
One of the top three.
Yeah, one of the top three. But they have the high ratings, the high star rating, because that's very important. They have the huge network. A lot of doctors work with them, things like that, and so that's all taken into consideration. But yeah, hopefully that answered it.
Well, one thing that I would also mention about that is what I would also mention about that is that within each of those large providers, because we mentioned that they're all some of the top players, they have great plans.
Mm-hmm.
Within each one, they could have anywhere between 10, 20, maybe even 30 different options.
Mm-hmm.
So, and depending on the state you're in, the zip codes that you live in, that shrinks down some of the choices. And then you're just picking from a smaller group. So,
Yeah.
what I will say is it's a reputable company, and you just want to look at the choices that's available to you within your zip code to see which one might be the best one. And you're welcome to give us a call. We're happy to help
most
you out.
definitely. Yeah.
Or you could work with your current broker.
Right. That's right. And you brought up an excellent point. Broker. Well, with us, we're brokers, so it's more than one company.
Yes.
You're able to look at all the different companies, or you could just go to Medicare.com,
Yes.
Medicare.gov, and it shows all the plans. Make sure you put in you're welcome, Sue. Thank you for you're able to look at all of the plans in your zip code.
Yes, definitely. You have to
set
make
it-
sure it's by
yep.
your zip code.
Yep, you go in and set up your account, and then you go from there. Well, we have another question here.
And this is from Keisha.
Yep, Markeisha Logan Jefferson from Facebook. What do you recommend for a single female with no children and no history of any major conditions? I have a low thyroid and family history of breast cancer and diabetes, but nothing so far.
Are you're Keisha, are you asking for a recommendation based on
Medicare or under 65
health care?
Yes, if you could clarify
Medicare?
that for us. Yes, if you could clarify that, if you are still in the under 65 insurance.
There's some different options.
Yeah, there are some different options. That's one of those. Give us a call, contact us. We'll be able to look for it. So let's just say if under 60, if over 65, you're in Medicare, or if you're about to go into Medicare, and if you could afford it, probably the supplemental G plan. Premium averages around $100 a month, right around. It depends on what state, things like that. If you're over, and if you're going into Medicare
under 65,
wait a minute, if you're going into Medicare into 65, say for instance, if Markeisha is going into Medicare, then your illnesses and everything, whatever you have, doesn't matter.
So what he's saying is
Pre-existing conditions,
yes.
Pre-existing conditions really doesn't matter when you're going into Medicare. Yes, you do want to talk to someone and sit down and look at the plan, because each plan is different. It goes by zip code, and it depends. You're able to look at these situations. It may say, now this plan may cover this. This plan may cover maybe half of it, or something like that, just for an example. And that's with the Medicare side. Under 65, that's a situation also where you definitely need to sit down and really look at the different plans, because that could be entered into, when you sit down and you put everything into the dashboard, and it shows you what plans would do what, how is it handled. So that would be a good question. But here you seem you're relatively healthy. So I don't really see any under 65. There's a lot of options that comes into play.
So what I would recommend for the under 65 is um, we could certainly set up some time and we could look at your situation, and we also want to look to see, okay, based on um, there's going to be what's called um, the annual enrollment period when it comes to health insurance for under 65. And so
And
there's
what date is
healthcare.
that? That's November
That's November 1st
November 1st, right?
through January 31st. And
Right.
depending on the carrier and everything, the different insurance companies, there's some different options that's available. And so there's two things. So, one, I highly recommend start looking at this early. Um, and I'm happy, we're happy to talk with you and help you on that. Another option is you could go to healthcare.gov, and you do have the option that you can look around and get some quotes without moving forward and making a decision. You
Yes,
can
almost
save your
definitely.
information.
Mm-hmm.
You could do a comparison. You can check the box and it'll send you an email, and you can just have that, and we could talk from there. Or we could just set up a call and actually go
Yeah.
through it together.
And it's right, and it's a free service.
Yes,
it's a free service from us because we don't charge for any of these services. The actual companies pay us to serve you.
Mm-hmm.
That's what a lot of people, they don't know how that works. So that's just a good time to clarify it. A lot of people, they don't make the call. They won't call someone because they think they have to pay for it. But no, you don't pay for it. This is that the companies pay the same amount. It doesn't matter if it's an advantage, supplement, it doesn't matter. The fees are set by actual CMS,
Yes.
which governs everything. So we couldn't come in and say, well, they're going to pay us 500, so we can charge 600. Can't do it.
Mm-mm.
Can't do that at all. And if there is an agent or a broker out there doing that, they're going to be caught pretty soon, because they're really cracking down on agents that's doing things like that.
That's illegal.
Yeah, it's extremely illegal. Yeah. And so they'll take their license and everything. That probably the only job they'll be able to get after that is a job with the paper hat. But 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 that's just to clarify, just to give people peace of mind that when they call us, if they call us or anyone, you're not paying for any of those services.
Absolutely. So our contact information is on the screen.
Mm-hmm. And scrolling down Keisha, at the bottom.
Yep. We know each other, so you can DM me. You can send me a message.
Yep. And you're welcome. Keisha said thank you. So you are welcome, Keisha. Hopefully we did answer the question there. Mm-hmm. But yeah, you can give us a call and everything. All right. So that being said, no other questions. We've covered everything. Hopefully, you have a good idea of the difference between the HMO and the PPO, which takes us into our question of the day, which is basically what's most important to you when choosing a Medicare Advantage plan?
Yes. And I would, if we're talking about Medicare, because this is Medicare Friday, but for anyone, when you're looking at your health, what's the most important things? Because some people may say it's my doctor. Some people may say, right, I want to make sure my medications are covered. It could be a variety of reasons, but whether it is Medicare or under 65 healthcare, any kind of healthcare, you want to make sure you're thinking about what's most important, because that will help you choose the right plan.
Right. And also looking at your lifestyle, everything like that. Traveling, like I say, do you travel more, or do you visit the kids, grandkids, and do they live a certain distance away? I've seen that. We can have those discussions all day long. I know one beneficiary is going into a plan. They chose a particular plan because it was accepted by doctors near their kids. And they was like, okay, so what I'll do when I'm planning to go to the doctor, I'll just go let the kids know. I'll go stay with them, go do my doctor stuff and everything. We'll hang out together because they want to be involved anyway. Mm-hmm. And so, and that doctor happens to be their kids and grandkids doctor also. So it was it was very beneficial. So those are the type of things you have to think about when you're going to make a decision about a plan,
I just thought about one other thing. What if you decide initially when you're you may want to move to a different state. And so initially you're looking at plans that are within your zip code. So if you're looking at completely uprooting to a different state to be near that family more full time,
Right.
then you might have to make a different decision.
Yeah, you may have to make it. Yeah, because if you're in this zip code and you switch zip codes, you change plans. You can't take the plan with you, so you have to try to see what's similar in that area. Just go ahead and think about it. Hey, one day, maybe in a few years, I may actually move to this area. And you start comparing plans that way. You'll sort of have an idea, and especially with Medicare Advantage plans. Before we go, uh, they run year to year. We've done the show where they talk about
Annual enrollment.
annual
Every
enrollment.
year it changes.
Yep. The supplement plan, they'll let you know probably the biggest change with them will be we may increase our premium. Advantage plans, the doctor may stop accepting it next year, something like that. So that's why they run calendar year. So that's why they have the annual enrollment period each year, which is October the 15th to December the 7th. So that's why we wanted to make sure and clarify this HMO and PPO stuff, because it can be confusing. And that's really the simplest part of Medicare. And whenever we talk to people, it was like, oh, this is simple compared to the other stuff, right? Exactly. Mm-hmm. So we don't have anything else. We'll close it. We'll close there. And I hope we gave some good information. And if we did, please subscribe to the channel, share with friends, let others know about it. Need to contact us, talk to us. You want to have that financial checkup, or maybe time to look at the Medicare plans. You want to start planning to do that pretty soon. We're here for you. You can give us a contact and we'll make sure to do the best that we can for you. So on behalf of myself and Andrea, I want to thank you for tuning in, and we will see you Monday, same time, same channels. Have a good evening.